name is Cole Ryan, Dr. Cole Ryan, physical therapist and owner of Freedom Physical Therapy. Joined with me is my wife, Corey Ryan, also owner and general manager of Freedom Physical Therapy and Fitness. So we wanted to do our first podcast to talk about a lot of different topics and basically give you guys some information, education on what we're about.
Yeah, so why don't we tell them a little bit about ourselves?
Yeah, let's get right into it. So, graduated from the University of Findlay in Ohio, originally from Ohio. Met Corey in Powell, both big Buckeye fans. I asked her after I graduated school. I met her on Hinge. We went on a couple dates. I asked her just a few months into it, let's move down to Florida, and she was down with it.
Here we are. We've got a 1-year-old, happily married, almost one, July 13th, and very happy to be here. We moved down here. I started my outpatient job. I wanted something more than what we were doing. Physical therapy has a lot of options as far as treatment goes. We can do so many different things. One of those things being dry needling, which is a service that we provide that you guys have probably been seeing all over social media. It helps with tissue mobility, blood circulation, the healing process, along with fire cupping as well. Fire cupping, 10 times better than your regular cupping that you see all the time. I had it done by an in-home massage therapist, and it changed the game. I had the fire cupping done on my low back, and I said, we gotta start offering this. But anyways, back to starting our own clinic. We really wanted to change the game, change the narrative with what the profession is about. So physical therapy is a wonderful style of treatment for many different conditions. And I started to see this approach, and it wasn't really helping patients as much as the profession can. So I said to my partner, Zach, he's also a doctor of physical therapy, and my wife, I said, let's try to start our own practice. Let's change the narrative. Let's change the game. Yeah. So what sets us apart from other physical therapy clinics?
So what sets us apart is you walk into our front door, you know where we're about. You'll know that we're there for our patients. You know our beliefs, our morals, our values. And that's something that's really important for us, especially for me, being a Christian, faith-based leader in the community. And all we're trying to do is treat patients with compassion, evidence-based research, practices that are going to help you in the long run. So you walk into our clinic, you're going to see our cross over our front desk. You're going to see the founding fathers. You're going to see the Declaration of Independence, the Constitution. We love God, we love family, we love country, and everyone's welcome. You can walk into our front door. It doesn't matter who you are. You don't have to have, a religious background in order to come in and see us. We're going to treat everyone all the same with that compassion and respect. We're here to help you and to help our community members live healthier lives.
I think we also need to touch on we do one-on-one therapy sessions.
Yeah, so that's a big thing too. And my wife can attest to this. The one-on-one individualized treatment sessions are really important when it comes to physical therapy, constantly reassessing. If I have 2 or 3 people at a time, it's really hard for me to pay attention to body mechanics, your performance, your understanding. Are you fatigued? Are you starting to feel that pain and discomfort? If I have patients come in with low back pain or neck pain, and I'm working with someone that just had a hip replacement, I'm doing different things. I'm doing neck exercises with this patient while I'm working with the hip replacement. Things the patient with the neck problem, they're reproducing symptoms with the exercises. Well, that's a problem. We're trying to make you feel better. So the one-on-one treatments are really important at Freedom. And that's something we look into as far as profitability when it comes to a business too. It's maybe not the best business plan, but it's very important that we get good outcomes. So Corey and I both, we're not in this to get rich or get loaded, right? We're in this to help patients get better. And if we can educate the community on what we're about and why we do it and how we do it, I think that'll be the game changer.
I think too, multiple patients leads to burnout in physical therapists.
Exactly. So you're working with maybe 2 patients a day, max total 14 to 16 patients. You're seeing an ankle sprain and then also neck or shoulder pain. You're bouncing back and forth. It's really hard to maintain that rhythm, all right? Whether you've been a therapist for 5 years, 10 years, 20 years. All right, so how do we get the best outcomes? I'd rather see a patient one-on-one for 20 to 30 minutes than 2 or 3 in an hour at the same time. That's just fact. And I would say most of my colleagues would agree with that, but that's just not the business model right now. And we're not so much interested in the business model. We're interested in helping people, and that's what's going to help our business.
Yeah. So let's talk, physical therapy, we say, is probably the most conservative style approach.
Absolutely. So when it comes to physical therapy, before you get your imaging, all that good stuff, you're going to probably hear from your doctor, all right, let's try physical therapy. Well, why is that? Because your insurance doesn't want to pay for an MRI right from the start. Okay? And a lot of times, an MRI is just going to give you a visual. We have plenty of tests, plenty of movement patterns and measurements that we can take that can tell us the same thing an MRI would tell us. Big thing is directional preferences. What makes you feel better and what makes you feel worse? What are we doing that's reproducing symptoms? We want to try to avoid those things. And if we can eliminate or at least decrease the intensity of symptoms, we know we're headed in the right direction. So physical therapy is without a doubt the most conservative style of treatment for many, many different conditions. And you want to try to stay committed to it. So, this goes into our next topic. It's
a commitment, not a quick fix.
It's not a quick fix. It's a commitment, okay? And I know people probably hear it more and more, especially in the podcasting world. You're seeing it all over social media. So we can't fix you in 1 to 2 treatments. Now, maybe if you have what's called BPPV, that benign positional paroxysmal vertigo, right? Your crystals elude, maybe we can do 1 to 2 treatments, but otherwise, it's a commitment. We're looking at least 4 to 6 weeks, 2 to 3 times a week to make some physiological changes. Now, Corey would agree with me on this. You start working out, you're not noticing any difference. You start to get discouraged maybe after the 2nd or 3rd week, and then you have to sit back and say, wait, I need to reflect on this. It takes 4 to 6 weeks just to start building any sort of strength. And then if your chronic pain has lasted for 5, 10, 20 years, it's going to take even longer than that. Because with that time, maybe you have some muscle atrophy. Maybe, you're not as strong as you used to be. Your posture is terrible. You've lost some curve in your spine, like a lot of us have. It takes a lot of time to make those changes.
Yeah, I think too. So let's start from the beginning. You know, you feel this pain, you know, for a little while, it's not going away. You try some medication like Tylenol over the counter. It's not going away. So you go to a doctor. A doctor then says, let's try physical therapy, right? And so you try it, 4 to 6 weeks? And what do we do within that 4 to 6 weeks? How do we determine that they're getting better?
So it's a really good question. So we want doctors to refer patients to us. And I'd love to educate the community more and more on this, is we take tests and measurements and we assess your progress every 30 days or every 4 weeks, every 10 visits. And when we look at numbers and the objectivity behind numbers, if I see your range of motion of maybe your hip, or let's go with your knee bend. If you can bend your knee 90 degrees and then 4 weeks later you can bend your knee to 120 degrees, that's objective improvement, right? So big thing is joint replacements. We're looking at normal range of motion measures. So, I mean, it's not overly complicated stuff. It's just knowing and understanding like what the process is. Simplicity of it is, how much do you bend your knee when you go to stand up from a chair? More than 90 degrees. Try to stand up from a chair with your knees bent out in front at a 90-degree angle. It's difficult. So we know as therapists, you have to bend that knee a little bit more in order to squat yourself up, propel yourself up from a seated position. But, you know, that's what we're here for, is to provide people with education and understanding. And, you know, we do a lot of hands-on stuff too at Freedom. Not everyone does that. Manual therapy is a very important part of it, especially with pain management. You know, if I'm just doing some soft tissue work, just mobilizing things, helping the blood circulate, that's going to help with healing. That's going to help with mood, actually, as well, which we'll touch on that, the mental health side of it, and with regards to pain. But, you know, we take pride in treating things neuromuscularly, musculoskeletally, and doing manual therapy as well. So we kind of attack it from all angles, and you'll see the results by the test measures. You know, we'll measure strength with a digital dynamometer. So what that means is, as you bend your knee up, I push down, and when you break, not break like fracture your bone, I'm talking when you can't hold that resistance any longer, it's going to give us a measurement of that peak force that you tolerated. So you go from 70 pounds of resisted force up to 85, you're 15 pounds stronger. So,
yeah. So why would you say we're trying to prevent surgery?
So big thing is surgery prevention. I mean, when it comes to the pharmaceutical side of it and the medical side of it, I am very happy with how we've approached it from a multidisciplinary state, in a sense that we work closely with the doctors that we're in network with, and in network with meaning we have a relationship with. So, I mean, we get referrals from reputable, very, very, very good and professional doctors, orthopedic surgeons, neurologic surgeons. So those relationships have really helped us with, you know, just communication and giving patients better care. So the goal is for a lot of surgeons to actually do treatments that will prevent surgery. So, you know, surgery is a tough topic to discuss because some people think, I need surgery. That's my first option. All right, well, have you tried physical therapy? Well, no. Okay, well, let's try that first. And that, I mean, that's a lot of doctors' first approach is trying physical therapy first, 4 to 6 weeks. All right, have we gotten any better? Yes, we have. All right, well, let's keep going. It's a commitment. It can take 8 to 12 weeks. You know, it can take longer than that depending on how long you've had the pain or discomfort.
And how much you do at home, too. That's a big thing.
Okay, so
I need everyone to listen to this. You have to do your exercises at home, okay?
Yep.
We're just as guilty, okay? I'm preaching, but it's very important when we give you guys exercises and activities and movements to do at home, you have to do them. And if you don't blame me if you're not better or if you're not feeling better in 4 to 6 weeks, because you're only with us for 30 minutes to an hour, maybe a couple times a week. How many hours are you spending away from us, outside the clinic, doing your own thing? I have a lot of patients tell me, I do exercises and workouts in the pool. And I said, well, that's great. I'll give you some things to do in the pool. But the pool is not giving you much resistance, okay? So if I do some sidestepping in the pool for an hour, I might not get the same effects of doing a leg raise out to the side with maybe a 5-pound weight. So keeping that in mind is patients, or community members, clients, you're trying to paint your own picture. We're here to guide you. We're here to give you the paintbrush, okay? So the paintbrush being education, your homework, your home exercise program, 2 to 3 exercises. I try to limit it to those things, and some of these exercises may seem really, really simple. They're like, that's not going to do anything. Okay, well, if you're not doing them at home, it's probably not going to do anything, right? So compliance is a huge thing, and we need patient buy-in. I'm not just pulling these exercises out of thin air, all right? I promise there's a reason, there's rationale behind it. You do your 2 to 3 sets, 10, 15 reps. You're going to seriously notice some changes over that 4 to 6 week period.
Yeah. So let's go back to the surgery part of it.
Okay.
Like, why shouldn't we do surgery if therapy is working?
So not all surgeries are successful. All right. Let that be a hook. Not all surgeries are successful. Okay. And especially if you have a history of smoking. Smoking is a big no-no. And if anyone's still smoking, please consider your other options. All right. So when you're looking at surgical interventions, you're looking at trauma right from the start. Okay. There's a blade going in. They're cutting you open. There's going to be a lot of traumatic experiences. Now, surgeons have gotten really good at what they do, which has helped a ton. If you're looking at a hip replacement, an anterior approach versus a posterior or posterolateral approach, you're gonna notice a difference with the anterior approach. All right, it's minimally invasive compared to the other option. So, I'm very pleased with the relationships we've built with our surgeons because they're very, very good at what they do. But at the end of the day, it's still a traumatic experience for the human body. I've sat in on several surgeries. Keep in mind that this is the reality. They're cutting things, right? So if it's bone on bone, yeah, we can only do so much in rehab, in therapy. I've seen a lot of hip replacements and knee replacements very, very successful. And then take into consideration when I refer patients that have that bone on bone discomfort or pain, when I refer you to a surgeon, it's for a reason. I don't get a kickback from it or anything like that. It's because I've worked with dozens of patients post-op, different surgeons, and there are some surgeons better than others, right? Just like there are therapists, just like any profession. So, that's a hot topic, right? And what I'd really like to get away from, and I wanted to bring this up, it was part of our topic, was healthcare professionals dogging each other. So, I'm going to ask Corey, how many videos do you see of physical therapists dogging other physical therapists?
Oh, too many. Way too many.
Too many. And I mean, what are some of the things that they talk about? It's hey,
If you do this exercise, or if your physical therapist does this exercise, they're doing it wrong.
they're doing it wrong, or maybe you need to find another therapist, or maybe let's just respect each other's, approach. Maybe I have an 80-year-old and you're working with a 20-year-old, so things are going to be a little bit different. Maybe I won't do a clamshell with a 20-year-old, but I'm probably going to do it with my 80 or 90-year-old. So I wish we would get away from dogging each other, dogging other professions, because that's not conducive to what we're trying to do. We're trying to build up the profession. I mean, we're doctors of physical therapy. It's been a doctorate for, I would probably say close to 2 decades now. So this isn't news that, physical therapy is going to become a more respected profession if we build each other up. Let's give suggestions. Big suggestion for me is let's build each other up. Let's figure out how can we help patients the most without saying, hey, is your physical therapist doing this? Yeah, well, maybe you need to find someone else. That's not a good approach. We can give suggestions, ideas, comments and stuff, but the negativity behind it, and even other professions, when you're dealing with, surgeons or your family medicine or chiropractors, it's really like, let's just all try to work together.
Team.
It's a team effort here. We're trying to help patients. It's not like, oh, well, you don't want to go to that guy. Now, I'll give you ideas on people I do want to send you to, going back to our surgeons. We got good people that we have good relationships with. And, I've had several patients. It's like, hey, go check out my ortho guy. He's really good. You'll be pleased. And, we've seen their work too. And I mean, it's impressive work. So we've come a long way when it comes to surgical intervention, but the big thing is keeping in mind, do you want surgery? Because if you already made your mind up, physical therapy is going to be a tough gig, right? We're going to have trouble making changes because it's about patient buy-in too. Mm-hmm. If you're coming in and you got this bad attitude about it, and, well, I want surgery. Okay, say you do want surgery. Let's do some prehab work. Okay, so you don't have to think about the vigorous intensity exercise and therapy you have to do after the surgery. Put yourself in a better position.
Yeah, so remember, if you have surgery, you're probably going to be sent to physical therapy afterwards anyway.
Right, so if you're going to have surgery, odds are you're going to have physical therapy regardless. So it's not a bad thing to do prehab either. I've got, individuals come in, they're having back surgery. Well, let's try to work on the back. Let's try to work on the stability. Get rid of some of the pain, give you a little bit of relief, and once you're out of surgery, you're feeling that much better.
Yeah. Let's talk about the mental health of impact of pain.
Okay, so pain is so debilitating, and I get it. I've got a history of pain and discomfort, especially affecting the low back. I played football in high school and just crushed my spine. I'm maybe 5'7", and I'm just going straight horizontally into a 300-pound guy, and I'm crushing my spine. And now I've started to notice it. I've started to pay for it a little bit. So it's really important to keep in mind that pain affects people so differently. And it can cause depression, anxiety, other mood disorders. And it's actually interesting. So I was just reading this the other night in prep for this podcast. 35 to 45% of those who report some level of pain also report anxiety, depression, other mood disorders, trouble focusing, difficulty performing at their job or in their workplace. And so it's really important to address the pain before it gets that bad. If you start to feel something uncomfortable, or you feel a sprain or a tweak or something in your shoulder or wherever it may be, you can go see a physical therapist. All right. I had a previous history of hamstring issues, and my parents didn't really know too much about physical therapy. Now, if I would have went to a physical therapist back when I had my injuries, do you think I'd be 100 times better? Absolutely. Because going through with an educated provider with regards to a hamstring injury, that would have changed the game. So, example being, I injured both hamstrings sprinting. I was a sprinter in high school. And when I tell you one went, a couple months later, the other went. And if I was able to build up some strength and isolate at the hamstrings, it would have been 10 times better. I mean, the performance side of it too. And I want athletes to hear this. If you guys are watching, if you have an injury, hamstring, hip flexor, the snapping hip syndrome, come see us. Come see our physical therapy team. We'll help you put yourself in a better position, competitively speaking, because you're just going to put yourself at more risk of a worse related injury. So when I tell you all the different services we offer, dry needling, scraping, so the instrument assist soft tissue mobilization techniques that we do, those are really cool things to do, but we want to really look at strengthening the areas of discomfort, pain. So stretching is great, but stretching really doesn't often give you the relief, and it definitely is not going to give you the performance. Because what are you doing when you stretch? You're lengthening the muscle tissue. And so you're stretching before you go to perform. You're just asking the muscle during a stretch to relax, and now you want it to go out and sprint and contract over and over and over again. You're looking for a hamstring strain. You're looking for, maybe if you're a volleyball player, you're looking for a strain in the chest region or the shoulder. So education is a really big, important component to performance. So, that's what I can provide you with as far as treatments go there. And then another thing a lot of athletes probably are aware of, the quad to hamstring ratio. So that's really important. I had no idea about when I was a high school sprinter. So you really want your hamstring to be roughly around the 66% of the strength in your quad. So if you're looking at, all right, my quad, I can extend my knee with about 100 pounds. I want my hamstring to be able to curl up maybe 60 to 65 pounds or so to get yourself in that comfortable position. So there's research out there that supports that quad to hamstring ratio and decreasing your chances of injury.
All right. Let's get into insurance.
So insurance, wow, that's crazy. So you want to talk about the wild, wild west? My goodness. So I know a lot of patients maybe don't care, which is fine, but I have to care, right? In order for us to provide you with top quality care, one-on-one, individually, I have to play with it a little bit in the system and how it works. So insurance really, doesn't pay us a whole lot. Now, I don't know how much people think we make or how much we make per session or how much my salary is. It's not much, okay? I'll be honest with you. So we're in this, though, to help people. We're in this to connect with the community, really spread the word of what we're about, our beliefs, our morals, our values. But when it comes to insurance, don't let it dictate your health. Do not let insurance dictate your health. So we have a lot of contracts with insurance companies, and it's very bizarre how it works. So I'll give you guys an example. United Healthcare, we accept a lot of their plans, but that's just it. We accept most of their plans. We somehow don't accept all their plans. So it's not just
Oh, well, I'm set up and I contract with United Healthcare. Do you guys take my insurance? Well, we have to look to see if we take your insurance plan. So it's not just United Healthcare. It's your United Healthcare insurance plan. So, if you're looking at your plans, we'll check to see if we're in network or out of network. But if you like us, you really enjoy your treatment sessions, you feel like you're starting to make some gains, don't let insurance ever dictate your ability to come to therapy. And we'll work with you on a number of different ways to access us.
Yeah. Even Care Credit, you have people who don't really want to put that investment out there. They don't want to finance, through Care Credit, but you got to think, like, are you financing a TV? Are you financing, your phone or a car? Like, why can't you invest in your health?
Yeah. So hot topic right here, hot topic. You're investing, in your mani-pedis, you're getting your hair done, you're financing your Corvette, maybe you're financing a TV, you're financing furniture. You're allowed to finance your health. It's okay. If we didn't have Care Credit as an option, our 13-year-old dog wouldn't be here with us.
Yeah.
Okay? So, I could get pretty emotional about that right now, but I'm going to stay on task here. She had to have an emergency splenectomy. If we didn't have Care Credit as an option, she wouldn't be with us today. So it's a really cool option that we've been able to provide now, and it actually opens up a line of credit, which is good when it comes to credit building. So our treatments are really affordable too to begin with. And when I say affordable, we're providing you with this top quality care, very hands-on, constantly assessing, reassessing, and it's that best bang for your buck here. Okay? So when we're looking at things like Care Credit and, financing your health, it's like you want to take care of yourself. So take care of the root cause of your pain and discomfort. And we talk about that a lot as root cause of things. So, we have options as far as Care Credit, 30-minute or just lesser time treatment sessions, trying to work through your insurance.
Other payment plans, packages.
We have packaged plans where you pay for like a block up front and you get a discounted rate. So, we have a lot of options, and, we don't want the price of things to scare you away, but we need you to understand that we have responsibilities as a business, and especially privately owned. So I don't have 3 or 4 other clinics keeping us afloat. It's just us. We're privately owned, and we've got to make a living here. So we can't do therapy for nothing. So
I think too, you'll see our 11-month-old daughter crawling around there. We want to be able to raise her, and she comes into the office. She's pretty much Freedom's mascot.
Yeah, Freedom's mascot, right? Our almost 12-month-old, 1-year-old daughter, beautiful. And you come into the clinic, you're probably going to see her either it's Monday, Wednesday, Friday. And she's just a blast to be around too. And it's a family operation. So, we're providing good care. You're in a good environment. You're feeling the vibes. It's a family operation. We got a golf simulator. We should probably talk about that.
Probably.
So we have a Titleist Performance Institute certified expert. So TPI certified expert. And we have our Freedom Golf programs set up, go through a number of styles of treatments. So we're looking at screening, assessing, and addressing. And we have a golf simulator in-house. So you come in, we'll do some exercise to address your limitations, and then we're going through and hitting some golf balls, seeing what's changed, what's gotten better, what's gotten worse. So that's not something that physical therapists or other clinics offer just anywhere. So you bring your own clubs. We got clubs free to use. So a lot of cool things that we're doing. We also do pelvic floor therapy. Now, I'm not the pelvic floor therapist, so I can't speak on it too much, but what I'm telling you is things like, incontinence, pelvic floor pain, sexual dysfunctions, pain during sex. Those are all not normal things. And you can see our pelvic floor therapist to try to address those things.
Yeah. So I kind of want to touch base again more like on the insurance. We just have to remember it's an investment and a commitment.
Yeah, it's really important to keep that in mind, that this is your body that we're talking about, all right? You're 40 years old. Let's just come up with a scenario. You're 40 years old. You got low back pain. It's not bad. It's maybe a 3 or 4 out of 10 on the pain scale. Hurts a lot when I get up first thing in the morning. That's the perfect time to do something about it, right? So it's not normal to wake up with pain. You wake up, you go through your day, and you just feel exhausted, fatigued, back pain. Maybe it's affecting other things as well. Come see us. Come see a physical therapist so we can address it before it gets bad enough to where maybe it's causing that depression, anxiety, right? So those conditions are so prevalent in our society today. It's like, let's not wait until the pain's debilitating or it's causing mental problems or mental health problems. We can do a lot of different things. Dry needling's a big thing that we do, and I touched on it briefly. So we're doing a summer special, free session. Give it a try. Come in. You do your dry needling. You can do some fire cupping as well. First session is completely free, and it's just to give you guys, give the community an idea on what it is, what it does. Who knows? Maybe that's a game changer. Maybe that helps more than the pain medication you're taking.
Be a long-term effect.
Long-term effect. So you follow your plan of care. We have research that's come out with the AAMT, which I'm certified through. So you're looking at plan of care you're following, several weeks, 2 to 3 times a week, with the potential of a 24-month carryover. So that's 2 years, guys. So if you're looking for a quick fix, it's just not going to happen, right? So whether it's post-op pain or weakness, you don't like medications, but you're taking them because it kind of helps with the pain. There's no real quick fix. And if anyone finds the magic wand for the quick fix, please let me know, because I'm willing to invest.
We'll invest.
We'll invest in it, all right? So dry needling is one of the closest things that I have to my magic wand. All right, so what we're doing is we're taking these very small needles, sterile packaging, individually packaged, and we're placing them in trigger points or acupoints, and what we're doing is we're trying to stimulate that healing process. Maybe it's some tendonitis you have from overuse. And we add the electrical stimulation, we do some winding of the needles, you get a mechanical process that occurs, and the idea is 10 to 30 minutes left in situ, so in place for that period of time. You're going to get results from it, but the commitment has to be there. It's just like anything else, okay? There has to be some level of commitment. I tell people maybe sometimes you'll get some relief after the first treatment session, but that's not always the case. If I try it on your low back and you're like, yeah, that didn't help. Did it make things worse? Probably not. And I do the first session for free. We got package plans available, care credit like we discussed. It's going to help you. I promise it will help you. The protocol that we follow is a lot different than it was, 10 years ago. It seems like, back in the day, it was you're sticking the needle in and you're taking it right back out, or you're doing a pistoning maneuver where you're sticking the needle in, just going back and forth. That's not fun. That doesn't really feel very good,
No.
right? So I've had it done. It's not a fun process. So it's a lot's changed, and I truly believe it helps people. I wouldn't do it if I didn't think that was the case.
I think too we need to talk about the pain afterwards. You will be a little sore.
Yeah, there's always potential for soreness or bleeding, right? Because
Not even just with dry needling, but therapy alone too.
Right. Okay. So soreness with physical therapy, dry needling, a lot of the different things we're doing. What is soreness? Let's talk about it. So soreness, basically your body's making physiological changes to get used to the load. All right. So in order to get stronger, you need to do exercise or lift or work out in some case. So stronger, I mean like endurance, strength, power, whatever, however you want to define these things, you have to do some level of movement. And the movement is key. All right. So physical therapists work in movement patterns. And we're looking how the body works, how the body's supposed to move. Maybe you have really rounded shoulders and you're coming in with neck or shoulder pain. Well, that's a good place to start. Let's try to take the rounded shoulders out of the equation. So if I'm having to do some exercise and you say, I'm sore, I don't want to come in anymore, this isn't fun. It's not meant to be a experience when you come in, we lift like 1 or 2 pounds and you don't feel anything at all. We have to push it to some extent in order to make those changes, right? If you just continue to lift, let's say I'm lifting, this weight and it's 150 pounds I'm deadlifting. If I just continue that 3 sets of 10, 150 on deadlift, and I never go up in weight, I'm not going to get any stronger than that, right? So you're going to reach a limit. You have to progress through it. And that's why physical therapy is important too, is because you're progressing as you're going through our treatments. So we're looking at, let's go up in weight, let's go down in weight. Maybe you were too sore. It's going to be important to constantly reassess.
Yeah, and I think communication with the therapist as well. You're going to ask them, how you feeling today?
Yeah.
And if you just say, oh, I'm good, we're not going to know any different.
Yeah. So if you come in and I say, hey, how you doing? Yeah, how you feeling today? I need some more descriptive words. Okay. So the big thing is, well, I'm a little sore. My shoulder's bothering me a little bit. I have a little bit of pain. Okay. We need to maybe drop down the weight a little bit, intensity, sets, reps, things like that. So, all right, guys. Well, I think that's all we have for today. Any other stuff you want to touch on briefly, or are we good?
I think we hit it all.
Okay, so again, my name is Dr. Cole Ryan, physical therapist and owner of Freedom Physical Therapy. My wife, Corey Ryan, also owner and general manager of Freedom Physical Therapy and Fitness. We appreciate you guys watching, listening to all of our topics and listening to our discussions. I thought we had some good things to say today.
Yeah, I think too, if you comment, let us know what you want to hear us talk about next.
Yeah, comment in the comment section, who would you like to see us have on maybe as a guest? Because that's something that we really want to do. We want to bring on guests throughout the year. I'm thinking we're going to shoot for a podcast per month. So again, thanks for watching. We appreciate your time. You guys have a blessed day.
Stay tuned.